Dengue is a mosquito-borne viral infection, found in tropical and subtropical climates globally. Dengue virus, or DENV, is the virus responsible for causing dengue, having 4 serotypes, indicating that it is possible to be infected 4 times. The virus is transmitted to humans through the bites of infected female mosquitoes, predominantly the Aedes aegypti mosquito. Other species within the Aedes genus can also act as vectors of chikungunya, yellow fever, and Zika viruses, but their role is secondary to Aedes aegypti. After feeding on an DENV-infected person, the virus replicates in the mosquito midget before it disseminates to secondary tissues, involving the salivary glands. Extrinsic incubation period, or EIP, is the time it takes from ingesting the virus to actual transmission to a new host. The EIP takes about 8 to 12 days when the ambient temperature is between 25 to 28 degrees Celsius. Once infectious, the mosquito is capable of transmitting virus for the rest of its life. Mosquitoes can become infected from people who are viremic with DENV. This can be someone who is asymptomatic, pre-symptomatic, or has a symptomatic dengue infection. Human-to-mosquito transmission can occur up to 2 days before someone shows symptoms, up to 2 days after the fever has resolved. In addition, there is evidence of a possibility of maternal transmission. When a mother has DENV infection while being pregnant, babies may suffer from preterm birth, low birth weight, and fetal distress. Dengue should be suspected when a high fever is accompanied by 2 of these symptoms during the febrile phase, including severe headache, pain behind the eyes, muscle and joint pains, nausea, vomiting, swollen glands, and rash. In case of severe dengue, a patient enters the critical phase, normally about 3 to 7 days after illness onset. It is at this time, when the fever is dropping in the patient, that warning signs linked with severe dengue can manifest. It has potentially fatal complication due to plasma leaking, fluid accumulation, respiratory distress, severe bleeding, or organ impairment. Virological and serological tests are used for diagnosis of DENV infection. There is no specific treatment for dengue fever. Patients with dengue should seek medical advice upon the appearance of warning signs. Antipyretics and painkillers can be taken to control the symptoms of muscle aches, pains, and fever. The best options to treat these symptoms are acetaminophen or paracetamol. Non-steroidal anti-inflammatory drugs, such as ibuprofen and aspirin, should be avoided, as these anti-inflammatory drugs act by thinning the blood, and in this disease with risk of hemorrhage, blood thinners may worsen the prognosis. Maintenance of the patient's body fluid volume is critical to severe dengue care. The first dengue vaccine, Dengvaxia, developed by Sanofi Pasteur, was licensed in December 2015, and has now been approved by regulatory authorities in 20 countries. Currently, the primary way to control or prevent the transmission of dengue virus is to combat the mosquito vectors, which is achieved through prevention of mosquito breeding, personal protection from mosquito bites, educating the community on the risks of mosquito-borne diseases, applying insecticides as space spraying during outbreaks by health authorities and active mosquito and virus surveillance. Adding up, research is in progress amongst many groups of global allies, in search of innovative means and pioneering strategies that will contribute in comprehensive attempts to intrude transmission of dengue, along with other mosquito-borne diseases.